Hello and welcome to Breaking the Cycle. My name is Alan Hyde, and tonight we are joined by a return special guest, Lori Russell-Siemer,
Yes.
licensed clinical
Social worker.
That's right, LCSW.
Yes.
And are you a supervisor or just LCSW?
Just LCSW.
Very cool.
Mhm.
And Lori, we spoke last time. Lori does different assisted therapies, psychedelic assisted therapies. We were kind of chatting a little bit before the show, whether that be with ketamine, and then some preliminary discussions that we might explore around psilocybin. Yeah.
Yes.
So we may discuss some of that. We'll probably most certainly discuss some of the ketamine assisted stuff and give some disclaimers and some safety discussions and what to expect. But welcome back.
Thank you for having me.
Yeah.
It's great to be back.
Absolutely. New studio. It's been fun to bring the past guests that were in the other studio in here. It's just nice to get you involved in all this.
Yes. Thank you. Fancy.
Yeah. So you do solo private practice.
Yes.
And you do the ketamine assisted therapies.
Correct.
From what I remember in our discussion previously, you do that with coordinating with certain medical professionals and sitting with the clients when they've actually gone through the dosages and these kind of things.
Yes.
Why don't we start with some of like what ketamine is, how you're working with that. We'll get into obviously kind of like the discussions we had last time that are a little more fun of like the spiritual awakenings and these kind of things that I think would be, the depth of what we could talk about tonight since we didn't have a lot of time last time. But why don't we give some of the disclaimers and understandings of like, what is ketamine? What is ketamine assisted therapy? Why are people seeking it out?
Sure. So ketamine is considered a psychedelic medication. When I think originally it was used as an anesthesia drug, so it is highly dissociative when people take it. There is some level of disconnecting from the body, which for some people who have been through severe traumas is helpful to kind of work through things when they're disconnected in that way from the body. So people seek ketamine treatment for a variety of reasons, sometimes for consistent suicidal ideation. For other people, it is treatment resistant or medication resistant depression, so deep levels of depression. And yes, like you mentioned, I work with a group of providers who, like when somebody comes to me and either they're interested in ketamine or I think that ketamine would be a good fit, we have a dialogue about it, and then I refer them to the physicians where they get basically like a mini psychiatric evaluation because there are some major contraindications to using ketamine.
Sure.
And so once they're cleared, they are prescribed the medicine, they bring the medicine to me, and then I sit with them as they do the medication. And we also do intention setting ahead of time so that they know what their intent or purpose is for going into the medication. Then they have their journey, and then after the medication use, because it's like a 2-hour session, and the ketamine only lasts about 45 to 60 minutes. And so we spend a little bit of time in preparation, then the actual medicine experience, and then we start the integration process. I also take detailed notes for people because sometimes it does with the effects of the ketamine and the direct like aftermath of the medication, sometimes it's difficult for them to remember a lot of the detail, like even a day later. And so while everything's fresh on their mind, I will take detailed notes.
Gotcha.
So that we can use that to discuss kind of what the symbols represent to them, what they want to pull from that, kind of like what is the ongoing medicine, meaning the lesson or the takeaway, what kind of like the juice that they're going to use to make the transformations in their life.
Yeah. I've got a few questions tonight that I really just want your perspective on. And we had such a great conversation last time. And I left feeling where like I come in as someone who works with 12 steppers. And before our conversation last time, I was like, okay, I don't know anything about this. All I've ever really known is like people who misuse it. And I left feeling so reassured in the benefits of a professional team assisting people in trauma treatments around this. So I'm also looking forward to deepening, just kind of my understandings around it, because, I'm passionate about my lane, and I'm not going to go over into this lane, but I like learning about it. And I know a lot of the viewers like learning about these things too. So since we have some therapists who listen to this, let's say they're interested someday in getting those trainings. They want to go down that route and make it their niche. How many clients could they expect to kind of see during a day, a week, so they're not burning out as well? Because for 2-hour sessions, I imagine, right, it's not the standard, like maybe 30 or under sessions that would keep you from burning out. I imagine it's less.
Yeah.
But what are some of the things around that a young clinician might want to know?
Right. So, I mean, I don't think it's massive in that, like, I don't think a lot of people are doing ketamine treatment right now. I think probably the clinics are seeing more clients because it can be kind of cost prohibitive to come to somebody's office. They also have to pay out of pocket, which is unfortunate. However, I feel like the quality of care is very different. I have friends in my personal life who have gone to ketamine clinics where they actually do the IV treatments. And it is a totally different experience. Like, they don't do a lot of intention setting. Sometimes they're even like watching a television show.
I remember you mentioning that last time, that it was just like, whatever, just take your pill or take the IV and whatever.
Right. And they don't do a lot of integration, if any at all. And so I do actually see some clients who will go, especially if they want to get a higher dosage, or if they truly are suicidal, or the medication resistant depression, they've tried ART, they've tried EMDR, not really making good progress. They will go in for IV ketamine treatment, and then I wind up doing most of the integration work when they finish, like, coming out of their treatment.
And when they transition to you, I imagine in your setting, there's not like a doctor right next door that does the IV and then they bring them into the office. Are they doing like oral pills for this? I have no idea how it works.
Yeah, so when they're treated like in office, they're prescribed an oral that it kind of like dissolves in your mouth, and you swish it around. You swish it for usually like between 10 and 12 minutes, and then you're instructed to spit it out. And then you kind of relax into your medicine journey. Yeah, I have heard, now I don't know this for sure, because the place that I work with does not offer at this point like the IM or the intermuscular, but I've heard some of the other places are offering intermuscular, so injectables, which I think is kind of interesting, and I'm curious to see how, because, when you go through training, it is experiential.
Sure.
And so I want to say it was either a 4 or 5 day kind of immersive experiential. We got to do 2 different personal journeys, and they were all in a room with all of the other clinicians who were also getting trained. So we did our first experience with the oral, and then we did the second with the intermuscular, and I will tell you the intermuscular was so much different than the oral. As far as like people having much bigger experiences, you definitely, like, I did not feel my body at all with the intermuscular, whereas I did feel like I was in my body the entire time with the oral. Yeah.
I would imagine, just from the standpoint of our chemical reactions with substances, right? The way that, you're ingesting that substance is going to affect your experience.
Yes, for sure. And so the bioavailability too is greater in intermuscular. It's even greater with the IV versus the oral, which I think is, don't quote me on this, but I think it's somewhere like in the 20% range versus much, much higher for intermuscular and even greater for IV.
Yeah. Let me check your statistics here. No.
Yeah.
Let's maybe just for a brief moment here, while we have somebody who does this work day in and day out, tackle maybe some of the more difficult points that come up and hear it from a clinician who's practicing in it. Which could be a good lead into like some of the disclaimers for somebody who might be listening, who is interested in these kind of things and what to be aware of. Kind of how you and I were talking about before of some of the studies in France around some of the side effects of ketamine when it's misused. Because you and I know as well, and we were kind of touching on this, is like as many well-intentioned clients who are going to come in and follow the protocol, there's going to be many more who don't. So, what are kind of some of those disclaimers that you give in your office so that people are aware of, like, these are the recommended ways that we do this and what to be aware of?
Yeah, well, I think people definitely want to have a sitter, and that's required for anybody doing at-home treatment. So there's all kinds of different companies that you can work with that do at-home treatments, and they'll have a person on Zoom, but you always have to have somebody in your house also while you're doing it. And I do think that is important because there can be heart issues that come up with ketamine. If you already have elevated blood pressure, like you're instructed to take your blood pressure before and after each dose. And so I think things like that are really important to be mindful and aware of. Because your blood pressure will go up on it.
I'm imagining your informed consent starts to look like a medical informed consent.
Yes, for sure. It's like 2 pages.
Yeah.
Yes.
Yeah. It's like, there's a lot of things you need to be aware of, but if you're aware of them and follow them,
Right.
it's been around for some time. A lot of people trust this intervention and
Yeah, definitely. I mean, I think it's really, really beneficial for a group of people, that are well suited for this type of treatment for sure. And certain types of medication, like there are very specific medications that are contraindicated to ketamine. So you want to be sure that you're aware of what those are.
Yeah. What are some of the ones you could think of just off the top of your head? You don't have to give an exhaustive list or anything. I'm mostly curious. And if you don't on the top of your head, we can move on.
I don't know off the top of my head, but some of them are psychotropic in nature, like SSRIs. So
I would imagine I was thinking like gabapentin or something that also maybe is used as like a painkiller at times.
Possibly. Yes.
Yeah. We could ask more geared minds in the medical field. But what's your policy on somebody has a history of struggling with substances? What's your policy on whether or not you would treat that individual?
I would definitely treat them because it actually helps with people who struggle with addiction. It just kind of depends on case-by-case basis. So I did have one person that I worked with. I ended up referring them to clinic just because there were some specific issues that kind of were red flags for me for working in the office in that type situation. I felt like, plus there was a difference between like what this client needed in the dosage. I felt like what the oral was going to provide was probably not going to cut it based on that person's individual history. And so I think it just kind of depends. It depends on the client. It depends on their history. It depends on their comfort level, my comfort level.
Yeah. And for those listening, right, because we have a lot of conversations about recovery and that nature here. If you're listening like, well, why are we talking about, right, what maybe some would consider controversial? It's like we're going to bridge some of these conversations with the spiritual awakenings and some of these trauma-informed points that you were already teasing, which is like it could be helpful for somebody who is struggling with substances, not in and of. Here's how I would maybe plant the seed and see if you would phrase this differently, is not in and of using a substance to help you with your substance use, but giving you the route to an awareness and an awakening that's going to help you break these cycles of behaviors that could be very unconscious for you.
Correct. Yeah, I would agree with that. And I think ketamine in particular opens new neural pathways in the brain, which enables, when people have deep levels of depression, some of those neural pathways go dark, shall we say.
Yeah.
And so this will light up areas of the brain that they didn't have access to before because of the trauma.
Yeah.
Does that make sense?
Yeah.
Okay.
Yeah, well, especially in the sense of blood flow, right? And a lot of psychedelics are shown to increase blood flow in certain areas of the brain, and that's one of those sole issues with someone, let's say, who's been drinking for a lot of years, someone who's been slamming heroin, right? It's like cuts off the blood flow to
Right.
certain areas of the brain where certain psychedelics have been shown to briefly, right? And that's kind of what I like about assisted therapies and those who do them in the proper channels is like it's a supportive process. And you know, if you're a 12-stepper listening to this, it right, like you had stated in the beginning, it's not for everybody, right? So if you're not into it, right, you're not into it. That's
Yes.
fine, right? And that wouldn't work anyway with any therapy. If you're not into it and you come into my office and you're just like, I don't want to talk to a dude. Okay, well then this isn't going to work. You know?
Yes. Yeah. And I do want to like differentiate too. There is a big difference between like using ketamine recreationally
Yeah.
and having the therapeutic component. The therapy involves so much more, even than going to clinic and watching something on a screen. You know, therapy truly is about the set and the setting.
Yeah.
You know, what does it look like? What does it feel like? Let's set an intention. What are we working towards to use this medicine? What are we trying to activate or open up? You know, what part of self are we trying to heal? What are we trying to access that maybe has been inaccessible? What is in the shadow? What needs to be brought to light? All of these kinds of questions going in, you know, and then ensuring that you have the right playlist with the right music and it's isolated sound. So you're wearing headphones or earbuds. You have a curated playlist that will kind of take you through like the entire journey of it. Most people like to wear eye shades also because also that keeps the focus internal, which is where it needs to be when you're doing therapy. You know what I mean? It's not about any kind of external stimulation. It's about going inside and recollecting or putting pieces together or developing a deeper understanding.
Right. What do you think people would need to know is the difference between doing a ketamine assisted treatment, which is prescribed medication, versus you know, mushrooms? Well, I'm sure you've heard this question before in some capacity or even in trainings it's addressed, but
Yeah.
what would people need to know about that?
Well, you know, psychedelic assisted therapy or psilocybin assisted therapy is available in other states. So, so clients can go to Oregon, they can go to Colorado, and they can have a therapeutic journey or medicine experience with psilocybin. And that's what I would recommend over just going out into the woods or going to a concert or something like that.
Mushroom.
Right. Oh, yeah. Mushrooms can be deadly,
Yeah.
like just out in the out in nature. But they're also very, very beneficial. And the beautiful thing about psilocybin is that it's a plant, you know, so it is of the earth. So those medicine journeys are a lot longer. You can have an experience with psilocybin for 4 to 6 hours.
Just get trapped in there. I'm just kidding. Kidding.
So you have to have somebody who's sitting with you for a longer extended period of time. But the people, I have had clients who have left the state of Texas, gone to states where it's legal. They do the psilocybin there, then they come back, and I do the integration processing with them.
Yeah.
And it's been beautiful. I mean, I've had a lot of clients who felt very stuck or they felt trapped either in a relationship or in a job. It's almost like kind of like what we would stereotypically refer to as a midlife crisis. I like to refer to that as like a crisis of consciousness. There's something that your soul is not sitting quite well with you, and you know you need a shift, but you're either don't have the courage or you don't know exactly what needs to shift. And so that is what I've seen huge progress with regard to psilocybin, specifically as a medicine, just kind of opening people up to the understanding of like, wait a minute, like I'm not even supposed to be doing this. I'm supposed to be doing this, or I didn't think I had any trauma, and now I've seen these memories come up, and I didn't realize that the way I was treated as a child is actually has affected me.
Oh,
And
deeply.
it's, impacting me as an adult and in my relationship with this work or with this partner.
Yeah. Yeah, just as you and I have had these discussions, and after our first discussion and things that I had looked into for more edification, it's amazing how certain therapy approaches very quickly become a spiritual conversation. I like we had talked about the last time you were on the show. It's like I don't know if that's I don't know if that's a coincidence as much as it's like this is kind of the inevitable path when you start walking down these paths. It becomes spiritual.
Yeah, I mean, I think it can be. I don't think everybody necessarily has a spiritual awakening or a spiritual,
Sure.
I don't know what the word for it would be, encounter or experience. But I know a lot of people do, both on ketamine and other psychedelics. So it can be really transformative. I mean, I know a lot of people who have used ayahuasca in a professional setting, like with a shaman, who have just had their heart blown open or their soul blown open and understood things about themselves and their history and who they are that they I don't think ever could have gotten there in talk therapy.
Well, that's it's interesting, that intersection, the point where you were kind of branching off of like not everybody has that spiritual experience or those spiritual awakenings, and I think that's an important call out too, because although that is something that we could all maybe acknowledge exists in the work, there are barriers that are sometimes insurmountable, or just I wouldn't even maybe always put it like that. For some that might be true, but then there are just some people that they're wired slightly differently in the way that they see and navigate the world, and we still just meet them where they're at.
Absolutely. And I think it depends on where a person is operating for the most part in their brain. If you've got somebody who is consistently in the neocortex and it's like their brain is online, fully functional, they're going to have the capacity to have sort of like an out of body or some sort of experience like that. If you've got somebody who's primarily, their baseline is dysregulation, and they're in the amygdala quite a bit of time, they're going to be more focused on like survival.
Yeah.
Yeah.
Yeah. And I imagine a lot of the work is moving them out of those places.
Yes.
Do they, during the process, is it both of you talking to each other? Is it predominantly them talking while they're under the process, or what is that kind of looking like, or is it just always different?
Okay, so are you asking about when they're under the influence of the medicine?
Yeah, what's funny is I didn't want to use under the influence as the term, but that's
Okay.
that's the term, So it's like when they're under the influence of ketamine, are they talking to you and you're taking notes, or you're kind of just
Yeah.
there?
So for generally speaking, the first 15 to 20 minutes, they are having their own experience. Like they're noticing sensations in their body. Your heart starts to beat. You might notice changes in body temperature. And so for the most part, it's just kind of like working through that and relaxing into the experience. And then once they relax into it, I have some clients who talk the entire time. And so I'm just writing kind of furiously, meaning quickly. And then other clients don't talk until they're kind of coming back into their body, back into awareness. And then they, will tell the story of the journey. And then I'm taking notes for them so that they have it. Yeah.
Yeah. Oh, cool. I didn't know what to expect in that. Just yeah. I mean, I would imagine a bit of both, but I guess a point of curiosity purely would be like, are they, when they are talking to you and they come out of the journey, are they remembering that they were talking to you?
Yes.
I don't know how significant this stuff is.
Yeah.
Like how under the influence are they?
Yeah. Well, with the oral, you're pretty aware the
Yeah.
entire time. And so, yeah, you're aware that you're talking. I can talk about my own experience. When I did the intermuscular, so it was the second journey I did during the training, I did not feel my body at all. And there was somebody in the room who was talking and they were upset. And I was thinking, I feel that way too. Is that me? Like, am I freaking out right now? I couldn't tell until I sort of like got into the medicine, and then I was like, okay, no, that's not me. But you're in this weird space, and it is different doing it in a group versus one-on-one. I do think
bet.
there is something very unique and special about doing it one-on-one versus in a group, because when you're in a group, everybody else's experience kind of bleeds into yours, and sometimes it's hard to tell what is you versus other in
Yeah.
that situation, which
Okay.
can be very disorienting.
I'm sure someone's having a bad trip.
Yeah. Yes.
I don't know. My mind just kept me like, I'd be that guy. I'm having a bad trip over here. Now everybody's having a bad trip.
Yeah. I mean, it's not, I don't know. It's, everybody has a different experience, you know? And so I do think doing one-on-one ketamine assisted psychotherapy with a therapist can also help you work through fears building up to,
Sure.
if you are afraid of being out of your body, or afraid of being in your body, or afraid of seeing something you don't want to see, or you just, you know, a lot of times people, I think it's a pretty common fear among humans to fear the unknown, right?
Yeah.
We don't know what, especially if you've never had this experience before, you don't know what it's going to feel like or be like.
I think that's an important call out too, because obviously, even before I knew anything about it, bringing you on the show to discuss it, I knew those aspects of like, it's not just you walk in here, take the pill, let's get into it, right? It's like
Yes.
there's a lead up, there's a build up, there's education, there's disclaimers, there's processing, there's discussing the fears, there's
Yes.
resourcing and grounding and all the
Yes.
trauma work that goes into it. And I think those pieces are always really important, especially in the state of the world where information is just kind of, it's like out there, to clarify that like, you're not just going to walk into one of these offices. You have to qualify, first of all, through the
Right.
psychiatric evaluations and all of these things. And then all of your concerns can be addressed as well before we're just jumping into it.
Yeah, absolutely. And I mean, I've had some clients that I've worked with for a year before they decide to do the ketamine assisted psychotherapy. So, yeah, for sure.
Yeah. And you know what's funny is it's interesting for me too, because I had definitely had years past, more so as a younger clinician, where working with 12 steppers, if this conversation would have come up, I would have been like, let's kind of skirt away from it, right? Mostly just from the standpoint of staying in my lane, but also because I hadn't sat down to have these conversations, you know, and it's a developing, the psychedelic world is a developing conversation, especially around trauma treatment. And it's kind of one of those feels in the field where it's like, you either keep up or not.
Yeah.
Yeah. So I value and am thankful for you coming and willing to have these conversations. It helps me,
Yeah.
especially someone who works with those affected by substances. This kind of stuff comes up often. I'd rather be equipped and know what's going on, so I can
Absolutely.
make the right recommendations or point the ones that really aren't going to benefit, right? Because they're just
Yeah.
they're looking for a rodeo no matter what. You know?
Right.
We'll keep those ones out of your office.
Yeah. Yeah.
Do we want to transition a little bit to the spiritual awakening side of the conversations?
Sure.
And maybe we can start with when we go into these realms, and any conversation I've ever kind of seen around the psychedelics and spiritual awakening conversations, it gets attacked a lot, right? There's a lot of negative opinions about it. And I don't even know if I'd say just like a lot of negative opinions as much as people have a lot of opinions. So what would be kind of your setup to give a framework of like, what are these spiritual experiences we're talking about that are less in the realm of woo-woo and more in the realm of like, this is working?
Yeah, absolutely. So I think when people are using psychedelics and these different centers of the brain get activated, in general, it can create like an opening, let's say. And in that opening, people can, to boil it down really simply, they can have some sort of epiphany. And that epiphany can be life-changing. An epiphany doesn't necessarily mean they hear the voice of God or something like that, but it's just suddenly they become aware of maybe a pattern that runs through their family lineage or through the ancestry, or some way in which they were conditioned. And there is this sort of subject-object split that can occur. In other words, they can be an observer and they can be looking at something removed, so they're not in it, which allows them to see a bigger portion of the picture. And that can help somebody like develop an awareness that they didn't have when they were in it, if that makes sense. And that can feel very spiritual and uplifting in nature because of the fact that it's like, okay, I was totally thinking one way before I did this, and now on the other side of it, it's like I see myself in this situation differently. I see myself in relation to these people differently. And so I think that kind of boils it down. It doesn't have to be religious or involve any entities or anything like that. It can really just be like a crack in the awareness and an opening that suddenly somebody realizes something they didn't realize before. And I, with my integration piece too, depending on what their beliefs are, I will meet them where their beliefs are, and we'll talk to them about, you know, what is the lesson in this? Like, what is the juice? What are you drawing from this that you can take with you? Like, if you had a seed that you gathered that you would want to plant in your heart, what would that seed be that you want to grow from this experience? And I also like to use art, because a lot of times people will have really amazing visuals. Like, I remember when I had the intermuscular experience, I saw myself, like, at first I saw a tiger approaching me, and I was like, whoa, this tiger is like really close, and I could see its eye, and then all of a sudden I was the eye, and then I was like the tiger, and I was like, you know, moving like a tiger, and I was like, wow, this is beautiful, and I was just hearing the tiger like speak to me, and the tiger was saying, you know, be brave, be bold, walk softly on the earth. And suddenly it was like I had this visual image, like I need to paint this tiger, and I want to put those words on it, and I'm going to hang it in my office. And I did. So that was part of my own personal integration, was being able to like create something from that messaging and then display it in a way that people read it.
Yeah. Well, there's a few really intriguing points from what I hear, and this is, you guys may have heard a lot of different things from what Lori was just sharing, so bear with me as I just kind of dive in on like the intriguing parts that I was hearing. Is like, obviously the first part of getting to the base of what people are talking about, even clinically, around spiritual work. I equate it the way you were talking about the opening, right? Of like just the different ways to observe and kind of be removed and see. I had a similar experience when I did experiential trauma treatment. And where I had opportunities to kind of really be outside of myself through like a physical process that was a whole week-long lead up and a lot of these different exercises. And I was an athlete for 19 years of my life, and so it just spoke to me in that way, kind of where I hear a lot of that in people who have some of these experiences and different types of assisted therapies, where that seems to be one of these universal mechanisms that happens, is like this stepping back awareness observation piece, especially with trauma histories. And the other one is slipping away from me. Get back in here. Get in here. Let's just go with that for a moment, because I think that's a really important piece of like the observation and being able to reapproach, whether it's relationships in your life or your job or the way that you're interacting with your own entitlement out in the world, and calling that back into place with proper boundaries and just being within you. And what a paradox, right? And that's the nature of our work. It's like, to get out of yourself, you've got to integrate and get back into yourself. And that's that one thread that no matter what modality and religious beliefs, spiritual beliefs, we all end up talking about that piece of like, how do you get out of yourself to remove the barriers to get back into yourself and be grounded?
Right.
That's trauma work too, I think, not a nutshell, but like in a way, right?
Yeah, for sure. Yeah. And so with the ketamine assisted psychotherapy, you know, I noticed that people have, like, it's almost like they can see their ego now outside of themselves, and the things that they were fearful of or worried about, they understand is not actually them, it's outside of them. And so then at that point they can choose, like, okay, well, do I want to wear this mask? Do I want to put that back on? If it were a cape or a coat, am I going to wear that, or am I going to leave it?
Yeah.
You know, and so then I feel like it can be very empowering, because then people start to understand that, you know, they do have things that they have control over. Not everything, you know, I understand there are some
the
things.
hula hoop, right?
Right, exactly.
Yeah. Well, you know, and I like that when I used to do men's groups, and I'll do them periodically every now and then. If I'm feeling frisky, I'll start up a men's group with the guys on my caseload, and I have the familiar faces that, you know, it'll be every couple years and they'll all kind of come back into it. And one of the warm-up exercises we'll always do is with the masks. The masks we wear as men, the masks we're told to wear from other men, the masks that we wear in relationships, and which ones don't fit, which ones don't work for you, which ones are just kind of like arbitrary, right? Or which ones are you really wearing to defend yourself, and which ones do you think are a part of you that aren't actually a part of who you are and who you've come to know. And the imagery is always really powerful. And I think that was that, as it comes back in from the ether, right? The thought I had on when you were talking about the getting the art piece down, right? When you had that visual experience, had gone through a lot of trainings. My family has a long history, background with, you know, Native American on my dad's side, and a lot of the conversations are finding your totems in life. And one of the things that I started to really pay attention to in my young life is like these hummingbirds keep showing up in my life, like the imagery of it, not like actual hummingbirds, but the imagery of it. And it's funny as I look back at like some major pivotal turning points, right? There was always like one of the billing services I worked with, their logo was a hummingbird as I was stepping into private practice. And then I remember these like little things back in the day when I would like play baseball, and it was the imagery kept showing up at these really not obvious times. And it can sound real mystical or woo-woo, but the reality is like philosophically, a lot of cultures have really highlighted the importance of grounding yourself and looking for these signs in your life. That could be imagery, it could be certain words or statements that people are using in good ways, right? And paying attention to these things.
Absolutely. I call that synchronicity.
Yeah.
Yeah. And there was a woman, I can't remember her name right now, but she wrote a book called E Squared that had like a series of 9 experiments that you could test yourself when you think about something, and you think about it and you think about it and you think about it, and then you start to see it like in your external. So it's just kind of an interesting concept as a whole. But the hummingbird, wow, that's like a very powerful totem. They're very small but mighty, because they're all about like the impossible journey. They defy physics, and they represent like the ancestors and the grandmothers and the grandfathers. And
one of the imageries I always loved when I started to pay attention to it was the burning forest, right? When all of the creatures are running out, the hummingbird is going back and putting the water droplets.
Yes.
And there was a dual-edged imagery in that for me of like, you know, I grew up in an alcoholic home, long line of alcoholics, right? I was stepping into my recovery journey and understanding myself better. And there was a real empowerment in understanding the things that I could control and the things that I couldn't control, and that it wasn't on me as that figure to be going back constantly to the burning forest. I had done my part. And really what that allowed is like, well, you know, I found a much more lush forest that wasn't on fire.
Yeah.
You know, and that forest treated me better.
And that's powerful.
Yeah. I did you know, it's like the imagery of that was always really powerful. Of like, I did my part, right? Whatever worked in me doing that part was great. And the parts that weren't working for me, or the ways that I wasn't being myself either, and trying to save, fix, or help people, I needed to remove myself from.
Right.
Yeah.
And I think that you touch on something that's so important. This idea that we are consistently throughout a lifetime going through a series of deaths, many deaths and rebirths over and over and over again. And you know, like they say, every 7 years you build an entirely new body, because every cell dies off and is regenerated or recreated. And so we really do go through, you know, through these ups and downs in life. It's like that's another thing that I like about the assisted therapies is that they can help people understand what needs to be shed and that it's okay to let things go. And I really like incorporating the seasons in with that too, you know, and talking about autumn is a time for purging and shedding, and then winter is a time for going within, which is kind of counter culture to what we're used to. You know, it's like,
Which is funny because that's, I mean, if you've been in private practice any period of time, that's when we get all our intakes.
Yes.
Everybody's looking to go within, right?
yes,
Because everybody around them has been lashing out.
yes, exactly.
Yeah.
And so I like to help people to like understand that their rhythm is unique in this planetary experience, and you don't have to necessarily follow the rhythm of what everybody else around you is doing. Like if that feels like too fast of a pace, slow down.
Yeah.
If you don't want to be out with people, it's your cave time, you know, and kind of helping them like give yourself permission to be intuitive, to follow your gut, you know.
Yeah. Yeah, especially having those conversations as you do this work, because there's an awareness that builds with support around the differences, right? And I was talking with a client about this morning who I've worked with for years now, and he's a recovery guy, and the difference between isolation and recharging your batteries,
Right.
Taking time for you.
Yes.
Right, that includes your hobbies, but also quiet time.
Right.
You know, and you as a clinician probably relate to this too. Is like, who has a full life and kids running around and a significant other, is like, when I finish my day, I need a little bit of that quiet time to transition, right?
Yes.
And learning those nuances that you and I don't just do that because we're therapists. People need to do that with work. It doesn't matter if it's your drive home or just like a quiet moment in the driveway that Hollywood movies have always depicted as some like bad thing.
Right.
The reality is like you need a few minutes to just unwind and then be an active participant in your life.
Yeah, I agree. And even just getting grounded, you know, like just coming back into your body, noticing your eyes are behind your eyes before you go in. And that's really helpful. I like to start my day super early. Yeah.
So I was about to
No,
go
that's
into
okay.
my own the 10,000 mile stare.
Yes.
So you start your day really early?
Yeah, I like to get up early when the house is super quiet before anybody else gets up, and that's when I, you know, do my meditation and yoga, just kind of set myself for the day. I see my first client at 7 because I'm much better in the morning. I'm usually in bed by like 8:30. So.
Oh, wow.
Yeah.
Yeah. Well, we've got you out pretty
I
close to
know,
that time
yes.
frame tonight. Yeah. 7 is brave. I used to do that. So I've kept my clients on that schedule because you know, we've talked about, I came from California. So they're up at 7. I used to be up at 7 with them, right?
Yes.
Because I have a lot of professionals on my caseload. But now it's 9 for me. So it's been really nice. I'm a 9 to 5 again instead of, you know, a 7
Yes.
to, what is that, 3?
Yeah. I usually work like 7 to 2.
Yeah.
Yeah. But I like to offer that early morning appointment because I don't work late. So I would rather get up early. But yeah, we have to be flexible and figure out what works for us, like what we can manage in our work-life balance, you know. And I feel like for me personally, that's really important because if I can't figure out how to do it, how am I going to educate and support my clients in doing that?
Yeah. Yeah. Well, I mean, and that's clear in the sense that you went through the experiential training of it, right? And I imagine there's few questions that come across your desk on these things where you're like, wow, I don't have an experience with this. And such is the beauty of us finding a niche, you know?
Yeah.
Yeah.
Definitely.
Yeah. Do you ever have clients that get into it and they're like, oh, no. Really?
To date, no.
Yeah.
Yeah.
So could you tell us a little bit more about that? So like they get into it and they're like, this is the greatest thing ever.
Yeah. So most of the time it's just short term. So it is by design to just do like a series of 6. Now, some people who have more severe issues or, you know, everything is kind of like on a spectrum. Somebody who might have more to work through might go longer. People who have like really severe treatment resistant major depressive disorder without psychosis, because psychosis is another thing that will not be a good fit for ketamine.
Yeah.
with those clients, sometimes they will do, like they'll do a series of 6, maybe they need another series of 6, and then sometimes they will be on like a monthly regimen where they just take it once a month, or maybe once every 2 months, once every 3 months, once every 6 months, maybe once a year. We talk about it, but I also talk about it with their team, like the medical professionals as well. And you can kind of tell, like, gauging when you're doing the diagnostic assessment with somebody who might be on the longer pathway versus somebody who can just have 6 and be well.
So, okay. So to clarify, someone who came in who was, relative term here, relatively stable, they're looking at maybe like a 6 session cycle. Someone who's got maybe more of a severe history or a more severe diagnosis is looking at a titration that's going to last longer.
Correct.
Like not back to back to back, but pieced out over a longer period of time.
Correct.
Gotcha.
Yeah.
What would you say, it's a kind of a left field question, and you may or may not have an answer to this, but while we have a platform to talk about, what would you say to lawmakers who this may come in front of and they're looking for information on whether we should make this more accessible or not? What would you, as a professional who does it day in, day out, say to them?
Yeah, I mean, I would definitely advocate for it to be more accessible, and I would love to see the insurance companies get on board with allowing the clinicians to bill for it, because I feel like that is the biggest prohibiting factor for people to do it in office, because the insurance is not going to pay for a 2-hour session. There's no way to bill for that. And if you bill the add-on, they don't cover it. So I feel like that would be really important, is advocating for the people who need it to be able to access it, and to be able to access it in the way they want. Some people want to go to clinic and feel like they want to be in that environment, and other people don't feel comfortable in that environment, and they want to be one-on-one in somebody's office. So
how would you package that as a presentation? And this, obviously, we could just brainstorm it, but like, would it be for the insurance company to allow for the add-on? Would that be the first door that we could maybe explore as an avenue that would be the abdication, or is it that we need a new code?
I would say either or.
Okay.
Just one or the, whatever works, I'm okay with. Just do something. Like I don't really have an opinion about which way they go, but I just think it needs to be addressed. I mean, just like with ART therapy too, those are recommended 90-minute sessions. There are 2 different scripts when you go through the basic training. One, you can push it and be done in 60 minutes. It's a challenge to get it done in 50. And if you do the other script, it's like, it's a 90-minute session. Yeah. Yeah.
So, and outside of an intake, they're not paying for that.
Right.
We all know that one.
Yeah.
I'm going to ask you a familiar question. All right. And we kind of already touched on this before the show, but we're going to be building a new mental health amusement park. We already built one in 2024, and we're going to build another one, and you get to build a ride there. What would the ride be? What would it look like? What would you call it?
Yeah, so I talked about it before being like a sound room, and I don't know, I'm just really into sound lately, and I did a meditation earlier today just on a whim, because I pulled a card and it was all about like whales and how they communicate, and I actually found a track on Spotify like where somebody had recorded whale sounds, and it was the most like relaxing. I mean, it was profound for me. Like I stayed in it for like 90 minutes. I was just like, oh my gosh, this is amazing. So I think I would create like a room that had like maybe light therapy, like blue and green, so you almost feel like you're under the ocean, and I would have those whale sounds, and just like maybe some like a very relaxing chase lounge or recliner that somebody could like really just relax. Yeah,
that'd be nice. We all need to take a load off at the amusement parks and kick our feet up. I thought for a second you were going to go into like a full aquarium kind of thing.
No.
Yeah, but Shamu is kind of out of taste these days, so we'll
I
stay away
know.
from
Have you
that.
seen Blackfin?
Yeah, God bless.
Yeah.
Yeah, that's what SeaWorld is wild. They're
Yeah.
wild. Yeah.
Yeah.
They did all kinds of crazy stuff.
Yes.
When I was a kid, I was like, yeah, Shamu. Now I'm like, oh man,
Yeah.
I wish I hadn't have been front row. I'm probably in the documentary, like screaming.
Oh, yeah.
Yeah. Any just last words with a captive audience that you would share as we close out tonight?
Thank you for listening. That's about it. I mean, I don't know. I appreciate everybody's time and the interest in different modalities that aren't necessarily mainstream because, they are, especially like ketamine is heavily researched at this point. So, yeah.
Yeah, and even still, with it not being mainstream, your willingness to come in, discuss it, educate us, all right, and leave it up to the interpretation of those who are listening.
Yeah.
Well, Lori Russell-Siemer,
Yes.
LCSW, thank you again for
Nailed
being
it.
here tonight.
Thank you.
Yeah.
I appreciate it.
Absolutely. Ladies and gentlemen, we break the cycle here every Friday night. We're here on a Thursday, but it is Fridays at 7 p.m. Central Standard Time. We will see you next week. Take care.